Welcome, students of NKT. This is another episode of Test, Don't Guess. I'm excited to have on today Laurie Di Giulio, all the way from Halifax, Canada. I hope I said her name right. I don't even know, but she is here with us today. And she is a movement and manual therapist, a massage therapist, and an NKT practitioner. Laurie, thank you for being on today.
Thank you.
Laurie, I just want to get started with you and how you got into the world of NKT and into the world of therapy, where you are today. You do a lot of things. I feel like there's a lot of good story that's going on with you, and I'd love to hear all of it. So I think you started all the way back in the year 2000. Is that correct?
Yeah, so my practice as a massage therapist started in the year 2000. And at that point in time, I entered that traditional role of massage therapist. And about 3 or 4 years into practice, I was actually just at a mall and I ran into this girl I went to high school with, and she was coordinating a massage program that was starting at a local college. And she said, "Hey, it's been like 14 years since I've seen you. How would you like to teach?" And I went,
"Oh, wow.
Shit, I've been like out of school for 3 years. I'm like, sure, why not? At that time, I kind of thought I could take on everything. And so I took it on and I'd been 3 or 4 years into practice, and then I started teaching. And I really thought that I dominated my anatomy. I really thought I knew my stuff. And then by 2014, I figured out that I didn't. That was my first NKT course. So I had been developing curriculum for American colleges. I'd been teaching in massage therapy programs since 2004. And so I had a really good background as a practitioner and had really great results. I had a great practice that was flourishing. And I guess it was about 2012, 2013, I started a practice in Collingwood, Ontario. It's kind of like cottage country. And at that time, I started working with a chiropractor and a personal trainer who were probably the best practitioners I've ever worked with in my life. They elevated my practice like I can't even describe. So the chiropractor there was Dr. Adam Martinick, and he's still in Collingwood. He took level 1 NKT with Kathy Dooley in Toronto back in, I think it was 2013. And he came back to practice and we had like a group meeting, and he's like, "I got to share this stuff with you." And he was just kind of learning it still. And I thought it was really interesting. And he said to me, you got to take this course. You have to take this course. You're going to really like it. You're going to love Kathy. And I was kind of humming and hawing about it. And then probably about 3 months after I started practicing at that clinic with him, I had my last horrible flare up of a disc trauma.
Oh, wow.
And so I had a really, really bad disc injury that I ended up getting surgically repaired. And he did some NKT stuff. And funny enough, it didn't work. And so he was just starting in level 1. And I had a pretty miserable disc that was successfully handled by surgery. But I was still really interested because what he was doing was so different than anything I'd ever seen in practice before. And so I dealt with my disc. And after that was done, I took my first NKT course. That was in 2014, I think.
Okay.
And so he really was it for me. He was the one that, in lots of other ways, not just NKT, he really elevated my practice and made me realize that I didn't know everything, and there was more to learn. Before then, I had my own clinic, and I was busy running a clinic. So I didn't have time to do all the continuing ed. I was busy with a business. And when I started practicing with him, I was moving away from my business, getting ready to sell it and move to Halifax. And it was just perfect timing because I had freed up time and I was able to start to do things for myself as a practitioner. Yeah.
That's what a nice guy to like go learn things and then bring it back and want to share it with everybody. That's what a great example. That's one of the things I love about the NKT community. It just like provokes people to want to like give away information and educate and share with other people. That's great.
Yeah.
Okay.
And I was really sad to leave that practice. Really sad. Still love him. Still love him and Jeff's the personal trainer that was there. Two awesome people.
That's cool.
Yeah.
So that was 2014 that you learned NKT. And then how did you progress through the levels? And what was kind of the struggles and experience of when you first started learning it? What did you think of it?
Yeah. So I took level 1 in February, the February classes. I think they've always been February classes, NKT level 1 in Toronto, in 2014. And then I took level 2 in July of that same year. And then it took me until 2016 March to do my level 3. And so for me, the big space was between level 2 and level 3. When I took level 1 was when I realized that, holy shit, my anatomy sucks. I shouldn't be teaching people anything. But I realized that we really just teach and we learn kind of a segmental form of anatomy. We just learn anatomy in pieces. We don't learn anatomy as a unit. And that's what I think that level 1 class really highlighted for me, was that, wow, I know my anatomy and I had no problem with the muscle testing and the names of the muscles and the origin insertion, but understanding the relationships between anatomy was really something that was missing, a really big piece that was missing. And for me, I mean, quite honestly, you have a bit of an ego when you've taught it for so long and you go in and you think, holy, like, I can't believe that I don't know this stuff. I can't believe that I'm having so much trouble making these linkages. And for me, and David, we've had a phone conversation about it because I have a very logical mind and it's very hard for me to be intuitive in this practice. So I really want to know what is happening exactly when I do this and what is happening exactly when I do that. And so that was a big struggle for me in level 1 because actually some of the people that were Pilates instructors or yoga instructors, I thought, how the hell are they doing this? And the reason why they were successful is because they had no problem just being intuitive, because they could drop that kind of logical part of their brain, and not in an offensive way. I don't mean that in an offensive way, but they were able to be intuitive, and I couldn't just be intuitive. So that was a really big struggle in level 1 for me, anyway.
And then what was it like? So you took level 1. And then when you brought it back into office, what was it like starting to use it with clients? Did you use it right away, or were you kind of stand off and practice more? What was that kind of experience like?
I think that I was kind of overwhelmed, like everybody is after level 1. When you get the manual, at that time when I took the level 1, you actually got like a paper version of the manual. And I had also bought the book, and I look at the book and I'm like, shit, big deal. It's like muscle tests. Who the hell cares? It's not that big a deal. And then you go in and you're like, wow, this is more than just you put your hand here to test an adductor. And so when I think that I probably gave it a little bit too long. I probably gave it about 3 weeks before I went, okay, maybe I got to start doing this. And just like everybody else, I got into the room. I was all planned. I'd reviewed my tests, reviewed the protocol, and then you get standing in front of a client who's depending on you to get them better or find something or do something, and it all falls apart. I don't know what happens. All of a sudden you get in there and you're like, no, I have no clue. I have no clue what to do. So I thought, at that time, I've got to come up with a plan. I have to come up with a way that I can just do this. And I just selected a few tests. And so 1 week I would select a few core tests, and I would just do it on anybody. And I wouldn't care about, everybody was coming to me for a regular massage anyway. So they weren't really expecting me to do NKT or to do some big digging. And so I just picked a few tests every week and I just did them on everybody. And I didn't try to find anything. I just tried to get a sense of what it was like to do the test and to practice the test. And then the next week I'd pick another set of 3 or 4 or whatever it was. I got people to stay 15 minutes later. In those times where I was really frustrated, I remember I was still with Dr. Martinick, Dr. Adam Martinick, and I remember being frustrated, and he said something to the effect of, you know, you were a really good therapist before. Like before you, yeah. And I'm like, oh. He said, yeah, like you got really great results before, and you're a really great therapist before NKT. So just do that. Because you were still really good before. And I thought, oh yeah, you can just do that actually, because I was good at it before and I had a great practice before. And so that really took it down for me. I think that made me panic a little bit less. One of the other things that I also did at that time, I was getting ready to move. So unfortunately I didn't get to stay in Toronto for long, which has all the big study groups. Yeah. So I moved away to a province where there was just me. I was the only practitioner in the entire area. I think the closest one at that, I don't know, no, there was nobody at that time.
Wow.
So I was alone. And so, you know, while I was still in Toronto, one of the other things that I did after I got super overwhelmed with doing a bunch of tests with actual people is I would just go, after I'd collected all this data, done on my test, found out if it was a neural lock or inhibited or not inhibited. And I just wrote down all my findings, and I looked at the client's health history, and I thought, okay, what is going on here? And I just thought it out myself. And so I collected all the information I could. And then when I went back, I had a plan. So I'd review my manual, and I'd go on the scholars page and do some searches. And that's really how I learned. I went in with a plan. The issue there was to not go in with an expectation of what I would see in a test, but just have a plan. So this is what I'm going to test now. And I put it on a little Post-it note, put it on the wall in front of me when I was testing or working with people, so that I knew where to go. I knew some of the common relationships other people had found and posted on the scholars page. So that really worked for me. And it helped me really understand anatomy from a functional perspective, because I always looked at it. I always went back and looked at it.
Yeah. Yeah.
And then you don't panic, because I think the problem is you get in that room and you're like, you get maybe 2 good tests out, and then you're like, I don't know what to do.
Oh, yeah. I totally
horrible.
Yeah.
Yeah.
What have you learned when you have panicked or have that confusion? What have you learned to kind of settle your mind, or like figure out, okay, wait a minute, I totally just lost myself in everything I just did. How do I get back on track? Do you have any tips on how to do that with people?
I think that the biggest problem there is ego. And that's I mean, it's like, you just drop your ego. It's like really easy to say, but super hard to do.
Yeah.
But I think that that's the biggest issue. And I think that when you realize that, there's a couple things that I think that new practitioners need to understand, is that really it's not your at first I was overwhelmed by the anatomy, but it's not the anatomy, it's understanding how to test. When you feel overwhelmed, there's still huge value in just testing and learning the feel, because it really is about the feel. There really is, although in level 2 we talk about patterns and stuff, there's no pattern in NKT. Anything can be related to anything. And so I think the biggest value is, even when you get overwhelmed, there's still big value in understanding that there's learning to be done by just doing the tests and understanding what they feel like. And then if you can, I've a lot of times just had my laptop in the room and said to people, listen, I'm just going to call for help. And so I get on the scholars page and I'm like, somebody is here, I need help with this. And it works. If people are really invested in getting better, then the scholars page, it's an international group of people. At any time of day, you should be able to get at least 2 or 3 people that are going to hop on pretty immediately and offer a little bit of help. And even if you can't find anything at that time, the perception from the client's perspective about how much you care and how much you're invested in their care is huge. Psychology is huge. If you can make them comfortable, make them understand that you're really invested in their care, that's better than finding a facilitated inhibited pair any day.
Yeah,
Really.
it's the how they feel about it. If they feel that like this guy is going the extra mile for me, that speaks a lot to them.
Absolutely. Yeah.
Okay, so 2014 you did NKT level 1, and then when did you get up to the higher levels? How did that progress?
I knew that I wanted to do level 2. Level 1, I felt like I was just picking stuff out of the air. Like I had no, there's a guideline, obviously, the gray boxes. You go to the gray boxes and antagonists. But I really felt like when I started to get more complex cases, where people had lots of injury history, where they had a lot of history of trauma, that it became really hard to weed through things. And so I knew that I wanted to do level 2, because everybody started saying, when you get on the scholars page and you start seeing that's level 2, it'll become easier in level 2. And so I started to get that feedback. And I had just moved at that time. So I went down to Boston in July to do level 2. And that was great. But quite honestly, for me, level 2 was the learning curve for me. And so I think that it was combined with the fact that 2 months before I just moved to a completely new place, and maybe that was part of it. maybe part of it was that it was in Boston, and I love Boston, and we went to see a Jays game and stuff, and it was kind of a packed weekend. But I think that level 2 is actually a little bit of a learning curve for me, because I think what it did, and not because it was more difficult, but because it highlighted again my lack of understanding in function. And so I think that for me, that the biggest issue was from the ego, and that my ego got in the way a lot of my ability to understand some of those relationships. And so when I did level 2, well, it gave me kind of a framework for where to go when I did my testing. I really went, oh my God, I can't believe, again, I went, oh my God, I can't believe all the stuff that I don't know, and became overwhelmed with it. And for me, actually, level 3 was the easiest.
Oh, yeah.
So I was really excited to get to level 3 and go, oh, this is awesome. And so, you know, when you get to that level, and when you get that overwhelm in level 1 and the overwhelm in level 2, or wherever you're getting your kind of obstacles, you know, it keeps getting said in the scholars pages that, oh, it'll get easier and it'll all become more clear when you do this level. And it really is true. I hate to be that person, because I was pissed when I was on the scholars.
I know, right?
I'm like, shit, I'm level 1. Everybody's like, that's level 2, that's level 3. I'm like, shut up. I just want to. And so it is true, though, unfortunately. And once you're at you get to level 3, and that's why it's kind of sad to see that there's, you know, 5,000 people on the scholars page, but in the master's page, you get hundreds, or I don't know what it's at right now, right? There's a big disconnect. And the truth really is that level 3 does make everything super clear.
Yeah, it really brings it together.
Yeah, and not that it's not valuable, because I find tons of level 1 relationships still. And sometimes that makes up a very large part of what my sessions consist of. Not that that stuff is not valuable, but it really progressing through all those levels is super important to really consolidating all that information.
Yeah, yeah. I like your cat, by the way.
I tried to ignore him. I was like
completely distracted. I was like just talking with the cat in the background. I don't know what's happening anymore.
I know he's not like dainty. I think he weighs like 40 pounds or something.
Oh, that's so good. Okay, well, so that's good to hear about, you know, how you've progressed through the levels of NKT, and I love hearing your story about it. Now, bringing you into your office and what you do with people, I'm curious, when you have somebody who has maybe never experienced NKT before, what's kind of your like elevator pitch to them, or just how you introduce them to NKT? How do you explain it to them? And then when you actually start doing the test, what do you do with them?
Yeah. I think as a massage therapist and as a chiropractor, there's always an expectation when somebody new comes in. When somebody new comes in to see me, they want me to do this for an hour. And so if that's the expectation, what I will usually do when I go in, if there's nothing underlying, then I can just do what I used to do for 17 years. But if there is something underlying and I really think that NKT will help, I usually go in by saying, am I allowed to do whatever I want to do? And they kind of look at me and they go, yes, or what do you mean? And then I'll tell them that I practice a system of muscle testing that can identify muscles that are overworking for muscles that are maybe not doing their job. It doesn't look like traditional massage, but I can work it into traditional massage and then kind of go from there. And so that's kind of how I explain it. When people come to me by referral, which I get a lot of referral from trainers and other therapists, then they've kind of had a preface. So they kind of know what to expect. What they often get told is that Laurie's going to do some weird shit and it works, but it's really weird, but just it works. And so that's usually how people come in if they get a referral. Or I get one of the trainers that I work with, she always says that she's a genius, just go to her. And I'm like, shit, stop saying that. It puts a lot of pressure on me. But people come in also with an expectation, and being in this area and the only practitioner in this area, sometimes I do get people who have Googled and found David's blog or David's Facebook feed and have searched out NKT specifically. So they're really Google informed, really well informed. But that's usually what I say. I say, I'm going to do some muscle testing, and it's going to look like just contracting some muscles so that I can find out what muscles are doing their work and what muscles aren't. And I think for most people, that's enough. And sometimes I spend a little bit more time educating about what's happening. And I think that for me, education is a really big part of that interaction, because I think that when people understand what's going on with their body, they're more invested in making a change, and they're better able to make those changes when they understand what's going on. If people come in and they're coming in for traditional massage, I use it as my assessment, and I don't often really explain it. I don't think it looks very different than range of motion assessment or some orthopedic tests. So sometimes I won't explain it, and I'll just spend 5 to 10 minutes doing a real quick assessment so that it guides my treatment a little bit. If I get free reign and they tell me that I can do whatever I want, then I'll typically have them dressed the whole time. Whether or not they're in kind of workout clothes or not doesn't really matter to me. And then I'll just hit a bunch of tests, get kind of a plan for where I want to go, and make the corrections as I go. I'll try to aim for about 5, up to 5. Sometimes it works, sometimes it doesn't. Sometimes I spend 40 minutes trying to find one. But that's usually how it goes for me. I found that too when I was first starting out, that I needed a plan, that I couldn't, because I'm not really intuitive, that I couldn't just go in and go, okay, I'm just going to see what happens. So I came up with, once I got through all the levels, it changed a little bit, but at level 1, I always did core. So core, I cleared breathing. I looked at somebody's breathing and I looked at somebody's core, and found that was a really good starting point for me. And that's what I did with everybody. For some people, if they came in with something going on in their knee and I didn't touch their knee, that was a big issue. But that was where my traditional massage came in. So just a little bit of rub at the knee, and sent them home with core stuff. So for me, I think that when I first started, when I went into an appointment where I had to do NKT, or where I was going to use a lot of NKT, coming up with a system in order of importance was really important. And I really just used common sense. And for me, that was central to periphery. So I tested centrally first, core, and then I moved out to the limbs. Yeah.
And so when you do have somebody who comes in and they say, you can do whatever, do the black magic. Do you do a lot of like pre-NKT assessments? Do you check the range of motion, single leg stance? Do you do a lot of that? And what kind of things maybe are your like standard protocol assessments if you do those?
Yeah. I don't do a lot of range of motion or orthopedics. Quite honestly, as a massage therapist, I think my orthopedics are weak. We don't really use a lot of them. We learn them, but we don't really use them in practice. So that's kind of a weakness for me. But I ask really good questions. And I think there's really good value in learning how to ask really good questions. And so I spend a lot of time asking questions. I ask about scars. I ask about surgeries. I ask about falls and injuries. I think you can gain a lot of information about range of motion by asking lifestyle questions, like when you check your blind spot, do you feel pain, or is it harder to turn one way versus the other? And so I spend a lot of time doing interview. And then, yes, I'll do some single leg stance is pretty standard. I pretty much do that with everybody. And then some level 2 assessments, but really very little range of motion. What I did start doing, actually just recently, quite frankly, is asking for them to reproduce the pain. So asking, is there something that you can do that will always reproduce the pain? And getting a couple of those so that I can use it as an outcome measure. And so they say, every single time I get up from a chair, it causes pain. Then I get them to do that a couple times. I look at them doing it, and that gives me a clue maybe as to where to go with my testing. And that allows me to go back and check. So, which is a little bit nerve-wracking sometimes. So after I've made something, they're like, shit, I hope this works. So after I go and I've done some corrections, then getting them to do that again, I think that's super valuable. And it wasn't something that I was doing at the beginning. I don't know if it was because I didn't think about it or because I didn't want the pressure of maybe it not working. but it's something that I found really valuable lately. Just asking, what is something that's always going to cause the pain, and using that as an outcome measure. I think that's my most valuable thing that I've kind of adopted.
Yeah.
And it doesn't always end up working for a variety of reasons, but it gets really good buy-in. So if people are on the fence a little bit, maybe NKT looks a little bit weird. The muscle testing doesn't, but all the TLing and stuff kind of looks a little weird. It gets really good buy-in. If you can make a couple corrections, and then all of a sudden something that was painful minutes before is no longer painful, it's really valuable for me and really valuable for them.
Yeah, that's something I've started doing in my practice too. Before and afters, make sure that you have really good reproduce the pain. And yeah, it's totally scary. You got to have some confidence to do it. And then it's like, it doesn't work. And you're just like, well, now we know that none of those things were the problem.
Yay!
Yay! Yeah, I know. I totally get that.
Yeah.
Give me just a good before and after like snapshot of what your practice looked like before NKT. I know you've kind of already gone into this a little bit, but like, what was, Laurie's practice pre-NKT, and then what is it now in comparison? And what do you think the best changes are that you've made since doing NKT?
I think that NKT has changed my practice a lot, but I think my practice, because I've been practiced for 17 years, it's naturally changed and progressed. I think it would have without NKT, quite frankly, too. But at the beginning of my practice, and I think it's kind of inherent in manual therapy, it was all about how much I could dig my elbow into somebody, and that was the value. And the public sees that as a value too still. And so people loved it. They thought, oh yeah, she's digging her elbow into me and I'm sore for days, and that's how I'm going to get better. And so even just without the NKT, my practice has progressed away from that. But NKT really, really helped me understand that that is not valuable at all. Unfortunately, it's still in the practice that therapists that are able to dig their elbow into you till you almost bleed are better therapists. And that's such a shame, such a shame. And I think NKT and other practices change that. And our understanding of manual therapy now has changed that. Before NKT, my practice looked like traditional massage. So the way a massage therapist really is taught is, if it feels tight, you rub it till it's not tight or till it's sore and you can't rub it anymore. And that's what my practice looked like. I thought it was fairly well informed in terms of anatomy, because I had been keeping up on my anatomy, my physiology, my path, and all of that. I had a good understanding of the sciences. But it really was very basic. It was rub something that feels tight and then send people on their way. Occasionally throw in a little bit of exercise suggestion, but not a ton. I have a background as a yoga instructor as well, so throw that in a little bit. But nothing really more. And so then when I started doing NKT, my practice definitely shifted from no longer do I have to jam my elbow into people, and I can really step back and make big changes without having to cause huge amounts of pain. And that was great. That's great from a therapist perspective, because it saves, after 17 years, it saves your hands quite a bit and your body quite a bit. But it's a big challenge from the perspective of the patient, because people still think no pain, no gain. And I was lucky and unlucky to move to a different province, because I could just start fresh. So I was able just to throw out my old practice, the old ways that I did stuff, and I could start over again. So I was really lucky there. And what my practice looks like now is leaps and bounds away from where it looked like. Way more of my time is spent educating people about movement. I would say that at least 15 minutes of a session is spent educating people about how to move better, which was never a part of my practice before, beyond the doorway pec stretch. Fuck, I hate that. I teach massage students now, and I'm like, listen, nobody's doing the doorway pec stretch. Nobody. It's stupid. Stop it. But now my practice is way more about education. I talk more to people. I educate more people about pain and about improved breathing and movement. And that was never what it was like before. In a single session, maybe I do 20 minutes of traditional massage. And that was never what it was like before. It was just rub people till they hurt. So I'm really, really grateful for that. Really grateful for the understanding that comes from NKT, that you can make big changes and not have to kill people.
Yeah. And, you know, we talked a little bit, I mean, you kind of said that you go down like two paths with people. There's people who, you know, want to get more into the therapy side, the NKT, and then there's people who kind of do want more of the traditional massage, and you are doing, you know, more generic massage. But how is you doing NKT even changed a lot of, I mean, you already just said with the pressure, but even in other ways, like the way that you might assess someone while they're lying on the table, or, you know, think about, okay, maybe I won't work them in the traditional sense of massage now that I know NKT. How has that kind of changed that side of your practice too?
I think that the two terms that I really learned to differentiate between in NKT was tight and taut. They're different. So understanding that something that feels tight to a client is not necessarily short. That there's a difference between something that is pulled long and tight and something that is short and tight. And that has, even if I did no NKT in any practice, that really changes how you approach a treatment, because no longer can you just put your hands on a middle trap and jam your elbows into it, jam your fingers into it, because you know different. And so if people are coming in for traditional massage, they won't get me elbowing their middle back. Pretty much 99% of the population won't ever get me doing that. And so that has changed a lot too. It's not very common that I don't sneak in a little bit of muscle contraction in a traditional massage. So even if I've done some work through somebody's mid back, I'll usually have them contract middle trap, even if I haven't done a test. Before people get off a table now, even if it's traditional massage, I've done no NKT, I have them do a little bit of dead bug to activate that TVA before they get up off the table, or press their heels into the table, because I know most of the population has multifidi that are crapped out. And so even if I never used NKT, those little bits, and I've taught them to my students. Because massage students will always say, you know, people get up off the table after an hour and they're sore. That's shitty. You know why? And so I've taught them that just get them to activate the TVA a little bit before they get up, activate the multifidi before they get up. And I think that alone really has added value to my practice, even if I never ever touched NKT again.
That's good. That's good to hear.
Yeah.
Well, hey, it's been super great talking to you. I just have a couple wrap-up questions that I want to ask.
Sure.
First thing is, in all of your learning, your background, all of your years of experience, and now coming into NKT, what are some of the things that have really helped you understand NKT, or even just build your practice a lot, that have been outside of NKT? Certain books you read, you know, you talked about how you thought you knew your anatomy, you came to NKT and you were like, whoa, there's a lot of stuff I don't know. You know, what kind of anatomy resources did you start looking up? What are good things that students who want to get more into NKT can start learning and doing on their own to build up their practice?
Yeah. Obviously, the blog, the NKT Scholars pages are amazing. Dooley is amazing. Dr. Perry Nicholston's Facebook pages are amazing. I also follow the GATE guys, and I think the GATE guys are really great on Facebook. They talk a lot about gait assessment and the elements of gait assessment, so they're great. I go through anatomy coloring books like crazy. I don't think that anybody can claim to not be able to look at their anatomy every once in a while. You always have to be able to look at it and review it. And so that was a really good review for me. I go through maybe an anatomy coloring book every year or so, just make sure that I keep up on it. Reviewing my client files is really valuable for me. Who else is fantastic? Anatomy trains. While some of the fascial information, I don't know what the current editions look like, maybe a little bit outdated, but I think the relationships between adjacent muscles that is talked about in anatomy trains is super, super valuable. Yeah. And all the geniuses on the scholars page. Thomas Wells, You got to look at Thomas Wells, right?
Oh yeah. Yeah. There's like books of information that could be written via NKT Scholars page.
Yeah, absolutely.
Oh, yeah. Well, Laurie, any last words you have? Anything that's just worth repeating or just something we haven't talked about that you want to make sure students know? Last word, let us hear it.
Last word, don't be overwhelmed by the anatomy. Don't be overwhelmed by what you think you don't know. The biggest learning that I had was learning how to be intuitive in listening to your patients. When a patient comes in and you're focused on doing all these tests and you've planned for it and you're doing these tests, trying to find these things, and they just keep saying, oh no, it hurts here every time you do that, listen to it. So many times I haven't listened. I've gone, okay, no, I have to test QL now. Yeah, I get it hurts there. You're going to feel it everywhere, whatever. And I haven't listened. And so don't get overwhelmed by the anatomy. Know that the learning comes from understanding what the feel of a test is. And you just have to keep doing the tests. It's not about your lack of anatomy knowledge, because many people are successful using a little bit of anatomy and a lot of intuition. And listening to clients, and not to get stuck in your head and get stuck on a plan or the gray boxes even, right? Absolutely.
Well, Laurie, thank you so much for being here. It's really been a pleasure. It's been an honor to hear from you, hear your stories and experiences. It's just been great talking to you. I love the laughs, the wine, the cat. So thanks for being here again.
Everybody do level 2.
Yeah, do level 2. That's right.
Thank you,
thanks,
Brandon.
Laurie.